Okay, go ahead.
Are we on working?
Yes, sir, go ahead.
Are we ready to go? You're shaking your head. Can you hear me?
Yes, we're
Okay.
ready to go. Go ahead and begin the meeting.
Fine. Okay, fine. We have 4 members, is that correct?
Yes.
Yes,
Okay, I guess that is appearance by the members of the public, that's happening automatically, correct? On a streaming?
Yeah, and there wasn't any public participation.
Okay, all right. We have the minutes from the March 19th meeting. Are there any additions or corrections to those minutes? Hearing none, a motion to approve, you can raise your hand. Thank you. We got a motion from Mary and a second from Phyllis. All in favor, raise your hand, say aye. Motion are approved. The minutes are approved. Items for information. I didn't see any on my list. Items for discussion, and Amy, do you want to go ahead and take over on this and explain some things for us? I will go ahead and mute me.
Sure. So pretty much the purpose of this meeting today is to look at a contract amendment for Mark First for the supported employment program. And so if you look at the amendment, the first part of it does an excellent job of explaining the purpose of the amendment. And so with the supported employment program, a lot of those services, because of coronavirus, are not happening. The individuals with developmental disabilities that were working are currently on furloughs, just to help keep them safe. And especially if they're living in a CELA or a community integrated living arrangement home, they don't want to risk those individuals going to work and bringing coronavirus back to that house. So anyways, the purpose of this amendment is just to expand the supported employment services into providing services at the CELAs also, so the community integrated living arrangements. And so the Mark First staff that provide the supported employment services, they're also currently providing a wider scope of services to the Mark First individuals that are living in the CELAs. And so that is the purpose of this contract amendment, is just to be able to expand the services that the supported employment individuals are providing. And so the first part of that contract amendment, it identifies the reason for the contract amendment, the expansion. And then once you get into the initial statement of work, it has the scope and tasks of what is being provided by that staff currently under the supported employment. And then the language that is underlined would allow the supported employment staff to provide a broader scope of services to include supporting the individuals that are also living in the CELAs. Anybody have any questions or feedback? And so the way that this would look differently if this was approved, the way that it would look differently as far as like logistics is that the supported employment staff, they would track their time, not only in what they're providing the supported employment scope, but they would also track time that they're providing to the folks that live in the CELAs. And then just a quick side note, they are still providing some supported employment tasks. It's just very limited. It's some staffing with the Department of Rehabilitation Services for the individuals, and then just keeping in contact with some of the folks that have jobs, keeping in contact with the supervisors to make sure that, the furloughs are okay and that they can resume their job once we're in the recovery part of the pandemic. Hope that wasn't confusing, and then whatever you guys have.
I have a question. This is Mary. My question is, when the restrictions, the quarantine, however you want to term our current situation, come off for facilities for developmental and intellectually developmental individuals, do we need to revisit this and put the contract back to what it was originally? There's nothing that brings closure to, proposed closure to this change, this amendment.
So this amendment would be good for the remainder of the life of the contract. So it would go through December 31st. And so some feedback on that, if we hopefully get into the recovery phase of this pandemic, then because of the scope of what the contract amendment is, then the Mark First folks would go back to like the supported employment piece. So like most of their time would be within supported employment. My concern was saying, okay, we're in the transition phase. And so we really expect you guys to just do the supported employment, and then we would meet again to kind of like do, the closure. Is that we don't know when there's going to be a vaccination for coronavirus. And so we may get into a recovery phase in, July or August. We may, just making this up, we may get into a recovery phase. And then in October, it may be very active again because we don't have a vaccination. And so with the amendment, it's not, it would cover them being able to provide supported employment services and provide services for the folks that live in the CELAs. And so it gives them that wider scope, and then it helps be able to fluctuate between what are the needs. And if we get into what I would say like a recovery phase, and then if the virus, if we have another outbreak and they have to go on another furlough, then the amendment is still applicable, and we wouldn't have to close it, reopen it, and do all of that.
Is this amendment brought about in part by state guidelines that are the state of Illinois Department of, that is over or sets the guidelines for boards such as ours? Are they recommending this change by 377 boards? And I guess I would just like to say that we would follow state guidelines. And I'm not setting any timelines. I'm suggesting we set any timelines, but we should follow state guidelines, just because this may go on for more than just the end of 2020. And I don't expect this to happen, but to cover any possibility of an institution saying we need these workers in the supportive living, now you've got to provide more workers for supportive employment. And I just want a little bit of closure so it's not totally open-ended.
So as far as the state guidelines, what's coming down from the state DD agency is very strict as far as the individuals that are living in the CELAs, they need to not be within the public because, you know, they're sharing a house with up to 7 other individuals. And so they're saying they're if you're living in the CELA, you're not able to work. However, with the supported employment program, there are individuals that are in that program that do not live in the CELAs, but they were also asked to take furloughs just because the supported employment restrictions on staff is that they can't really provide them one-on-one coaching right now because of just the social distancing and being around people restrictions. So that's what's coming from the state is that those restrictions, and so then that has put a lot of obviously barriers into the supported employment program for what it is because of those restrictions. And so they're still doing some staffing with the Department of Rehabilitation Services. And so like if Joe, you know, has a job and then they may do staffing saying, you know, Joe is working at State Farm and he is on a furlough. So it's very, very simple. As far as the CELA piece of that, yes. So there is coming down from the state that those services really need to have more people working them and also stability. And so they're trying to keep the same staff as consistent as possible as going into those homes. So they're trying to limit the amount of people that are going into working into those homes. And so there needs to be more of a more people available to work into the CELAs so that there can be consistency of them going into the same homes and they're not flip-flopping and going into different CELAs. As far as the other piece of that too, with the contracts at the state level, the suggestion at the state level with the contracts was that they're not necessarily monitoring some of the outcomes, that they're saying, you know, just provide services where you need to provide services. And so your question, Mary, as far as are they doing contract amendments at the state level, I wouldn't be able to answer that. I haven't seen any feedback on that. And as far as those logistics, I don't think I would see any feedback on that.
Okay, thank you for your explanation. And I just think that probably with the renewal and granting of grants of monies to agencies for the 2021 year, we can revisit this at that time.
You gotta unmute Vern if you're trying to say something.
Here I go. Am I on now?
Yes.
Okay. And when they get to the point of bringing their clients back into the workplace, this could be a whole different environment and a whole different program then as well. So I guess that we'll live with this, perhaps the shifting back and forth, and that was one of the questions that I'd asked of you, Amy, and you've explained that. But I think our contracts could well, from what their operations going to be, could be very different in 2021.
I completely agree, Vern. And so this is kind of like building off of the discussion that we had in March, when we met and you guys decided as a board that you didn't want to start talking about what some of those funding focus areas for calendar year 21 are going to look like, or what a forum may look like right now, because we're still like in the midst of this. And so we don't know what those things are going to look like. And so I completely agree as far as the supported employment program. I would think more than likely the logistics of that program are going to change as a result of this pandemic moving forward.
And what I had talked to Amy a little bit about was being left outside of all of this is what is a group of what for former UCP clients that haven't been able, for the most part, to get their foot in the door. I have no solution to that. It's just an issue that I feel. Any further question? Yeah.
Yeah, absolutely. It's like we had the closure of UCP and that created some challenges for the supported employment program. And we've discussed those as far as like not having enough people wanting to work in supported employment. And then, so that program was already kind of having some of those challenges. And then the pandemic came and it's definitely created more challenges. And so, yeah, this is definitely not the last discussion as far as what supported employment will be moving forward.
Okay, is there, are we ready to have a vote on this, or is there still more discussion? I don't want to wrap this up before we're ready. Jan, you look like you were getting ready to say something.
Yes, I'm ready to vote.
Okay. If that's the case, then all in favor of the recommendation that was put before us, raise your hands in agreement. None opposed, the motion is carried. What else do we have, Amy?
The only thing we have is if you guys can approve the money spent, the bill. The allocations paid for March of 2020, and then I think we have everything covered.
Okay, would someone sponsor that motion?
I move that the bills be approved for March.
Thank you. Is there a second? Thank you, Phyllis. Any further discussion? All in favor, raise your hand as aye. Motion's approved. Thank you.
Did we
think-
have a motion for approving and a second for approving the amendment?
Yes, I think we took that vote, did we not?
We took the vote, but I wondered if we had a motion.
I
Made.
think it was Jan.
Okay,
Did we have a second? It was Phyllis.
I said I'm ready to vote, so.
Yeah, thank you for that. I know the person taking minutes always appreciates clarification on who approved and who seconded it.
All right, it looks to me like and we talked about this at our last meeting, our spending in time on a forum is probably a little waste of time right now because it's likely not going to happen in the very near future. Anything else, Amy?
No, that was it, was just to get your guys' feedback on that and whether or not you wanted to move forward. So we can move forward with making sure that they get paid and they know how to appropriately track their time for that program.
Okay, our next meeting is in July, is that correct?
Yes.
Okay.
And hopefully in July, we'll know a little bit more about what to expect in the
How is working from home going?
It's pretty chaotic having kids and doing homeschooling and working, and I miss the old days of I went to work and they went to school. We're figuring it out, I guess.
You aren't alone in that predicament.
Yes.
Very good. Motion to adjourn then. Thank you. I have Jan, her hand came up, and Phyllis, it looks like you get the second. Any discussion? All in favor, say aye by raising your hand. We are adjourned. Thank you for your time.
Thank you.